Hello, my name is Brandy Adams, and I am a registered nurse with my associate degree. I'm in school now to get my bachelor degree, and that is the reason for this presentation. We were given the task to pick an ethical issue and discuss it in a presentation. So I picked one that kind of hits home and is more personal for me. My topic is, should we, as healthcare providers, tell the patient the truth about their illness, regardless of what our family wishes for us to do, whether they want us to tell them the truth or hide the truth from them? The reason it's more personal for me is because I work in the ICU, and of course in the ICU, the topic of terminal illness, and you see a lot of very sick patients. So end of life is common. So we do have to have that talk with a lot of patients. For this presentation, we're going to use an example, a patient that I had a couple of weeks ago. She was an 85-year-old female who came through the ER to us with respiratory distress. She had been having multiple respiratory issues at home: shortness of breath, chest pain, pain throughout her lung fields, her back area, dry hacky cough, and many more. So the doctors immediately wanted to do some CT scans, some x-rays, and labs. The scan showed that she had some spots in her lungs. At first, they were thought to just be septic emboli. However, they later discovered that they were actually masses in her lungs. The pulmonologist then performed multiple tests. One of the tests that he done came back that it was indicative of cancer. It was actually 3 times the normal level that it should have been. So the chances of her having cancer were extremely high. He mentioned this to the family, and in response, the family wanted to hide this information from the patient. They wanted to hide it for 2 reasons. One, they were afraid that the patient would refuse all treatment and all medical care because the patient was a high believer in God, and she believed that God would heal all. However, she did possibly have a very life-threatening illness, so they were afraid she would completely lock down and not want any treatment. They were also afraid that if we did tell the patient that she was likely to have cancer, that she had a long history of depression, anxiety, that she would immediately go into a sense of grief and anxiety and depression, and they didn't want to see her like this. So, and they didn't say whether they would want to do treatment or whether they wouldn't, but at this time they were wanting to hold all information in the word cancer. They didn't want to mention it to her. The pulmonologist agreed to this. Keep in mind, the patient was normally alert and oriented. However, recently she was more confused. She wasn't always oriented, and dementia was likely. So we're going to use this patient to explore some pros and cons of being upfront and telling the patient about their health and their illness. So we're going to talk about the pros of withholding information about a patient's illness. One pro would be, like the family said, it avoids the patient having anxiety and grief and going into disbelief. Because if somebody looks at you and would say, it's likely that you have cancer, your reaction may be that you just go into in complete denial. So we was avoiding that. However, it would also make it hard to provide further care for her, because then she wouldn't want to agree to the care. So it's kind of hard to withhold all information to avoid anxiety. Although that would be ideal, it would make it hard. Another reason is because a lot of people say that when you do figure out that you have terminal illness, or that death may be approaching soon, you lose all hope, and that can also affect your physical body as well. So they were afraid that the patient's health would go downhill, and that is likely. So that's another pro of withholding information. On the other hand, we have multiple cons of withholding information to a patient about their health care. Of course, the major con is that we are completely violating patient autonomy. That is, we are completely taking away their right to make their own decisions about their health care and how their life will go. patient autonomy is huge. You learn it in nursing school, you learn it in medical school, and you learn to always abide by patient autonomy. So we are violating it if we withhold information from any patient. Another con is that it creates a huge communication barrier. It did for me in this instance, because I didn't know exactly what the doctor had told the patient. I didn't know what the family had told the patient or what the doctor had told the family. So it's just I didn't know what I could say to each different person. I didn't know what I could or could not say. The patient would ask me questions. The patient confronted would ask me what's wrong with them and why they're having these symptoms and what I think it is, and I didn't know what I could say. So it kind of created a communication barrier, and I was afraid that it would hurt the nurse-patient relationship. I actually had to call the doctor myself and say, Dr. So-and-so, what exactly have you told this patient? I'm not sure how to communicate with the patient because I don't know what I can and cannot say. Another issue in withholding medical information to the patient is the long-term effects it's going to have on the nurse and the doctor and the other healthcare team members, because I've done a lot of research, and you can actually see my research on the links that will be attached below. They're great articles if you want to look at those. They say that nurses and doctors often deal with issues within themselves for weeks, months, and maybe years later after withholding information, because if the patient dies, you may have a sense of, well, I let that patient die in a lie. They didn't know what was going on. They died unexpectedly to themselves, but everybody else expected it. So it can create a lot of issues within the nurse and within the doctor, which can lead to burnout, nurse burnout. So it's really bad on your conscience as well. Another issue of withholding the care is a lot of patients, they will tell you that they would rather know when it's coming so they can set up their will. And a lot of patients too are living with a lot of maybe some bad personal relationships that they would maybe like to clear up if given the chance. And another thing, set up their living will. If they know that now they have a terminal illness, or they are sick, even if it's not terminal, they know they're sick enough to where it could lead to death, that they can set up their living will, or they can decide how they want their finances to be spread out amongst the family, or how they want their items or their personal belongings, and also how they want their funeral arrangements. And it'll really help the family in the long run too, because they know it's what would make the patient happy, and because it's preset and exactly how the patient would want it. It's, like I said, whether or not we withhold this information or whether or not we tell the patient is a huge ethical dilemma. I've had multiple instances of this already in my short term of being a nurse. And like I said, it's individualized for every patient. Personally, with this patient that I was just giving an example of, I was an advocate for wanting to tell her the truth, because we didn't even know if it was cancer for sure, and we don't know if it's terminal. So why not tell the patient and let her decide? I had a lot of issue with that. Also, she normally lives a pretty good life, and she's oriented, and she's 85, but that's really not that old, and she had otherwise a pretty good life at home. So I would rather tell her and let her decide for herself. But part of me also agrees with the family. Should we tell this patient who has this history of depression, anxiety, that she does have a terminal illness, or that she may have a terminal illness? Because if she does refuse treatment, then she's going to live the rest of her life with this anxiety. So it was a huge ethical dilemma. Whereas on the other hand, if it's a elderly patient who has multiple coexisting health problems, who is disoriented, who doesn't have that great of quality of life, what are the benefits of telling them? Because death is suspected soon anyways, so why tell them this and give them even more anxiety, more grief, knowing that death is coming soon? So it's really individualized for every patient, and you have to decide yourself within yourself and with each patient what you would like to do in this situation. I hope this video has given you many take-homes, and you can decide amongst yourselves with each different situation what you would like to do. I hope you've enjoyed the video. Thank you.